Let's make this here. Can you see the screen? Can you all see the screen?
Yes.
Okay, good. So today's workshop, we're gonna, so the main title is Unlocking the Puzzle, and then this will be like a comprehensive guide for parents to understand autism. As we initially introduced myself, my name is Julia Macarini. I'm a highly specialist senior psychologist. I currently work in East London in the John Howard Centre, which and I'm the lead psychologist there in it's a hospital, so I'm the lead psychologist in 2 of the wards. And one of the wards that I work for is the only specialist ward for autism in London. There's a bit of I'm going to go through a bit of an agenda of how we're going to run our workshop today. So we're going to go through a little bit of understanding what is autism spectrum disorder. We also might be referring to it as ASD, just to shorten it a little bit. We're going to discuss a little bit about the prevalence and what could be the potential causes for autism, what the main concepts of autism are, some challenging behaviors that can emerge from ASD, then what the most the most thing we're going to be focusing about, which is the emotional aspects for parents, understanding emotions in children with autism. And then I'm going to talk a little bit about a case of a previous patient of mine, which I've acquired consent to discuss. So I'm just going to give her a little bit of her perspective for when she got a diagnosis for one of her children. Then after that, we'll discuss a little bit of the difficulty managing emotions in children with autism, some of the risk factors, how the diagnosis process is actually done, some guidance around supporting your child. And then at the end, we're going to have a brief Q&A. So if you have any questions, please put them on the chat, and then we'll go through them at the end. And then I'll give you some additional resources, places where you can do your research, and so on. So we'll start a little bit with what is autism spectrum disorder. So it's a complex neurodevelopmental condition that we characterized with persistent challenges around social communication, interaction, alongside some restricted and repetitive patterns of behavior, interests, and activities. So what does that essentially mean is that it does affect some of the way that children might communicate. It can affect their speech, perhaps, or even the way that they express themselves. The social bit of the social communication is also, how they interact with the world. And then it can come sometimes alongside some restricted repetitive patterns of behavior. So for example, quite specific interests or highly focused interests, certain specific repetitive behaviors, and then some also sensory issues. It is a spectrum disorder. So the reason why we call it a spectrum, it means it varies how widely it affects the individuals or the children and adults as well, and how it impacts their abilities, behaviors, and the strength. So basically, it's not a one size fits all, it's a whole spectrum, and we have different presentations, but we'll discuss a little bit more of that in a while. When we do think about how that diagnosis is done, we think about what's called the DSM-5 criteria. So the DSM essentially is a manual of diagnosis that is widely used by
He's always eating like that.
Yeah. Sorry.
No, he takes it, sis, and then he eats it.
Sorry, can I just ask that we mute our microphones? Thank you. So essentially, the DSM-5 is a widely used manual that mental health professionals around the world use to base their diagnosis on. And then we have a criteria that we need to follow. So whoever is being assessed for potential ASD needs to fit that criteria. So we have, for example, persistent deficits in social communication and social interaction, some restricted repetitive patterns of behavior, as I previously mentioned. Symptoms need to be present in early development periods. So it's something that, so autism is a disorder that children are born with. So it's not something you develop, it's something that children are born with, or humans are born with. Symptoms can cause significant impairments. So it doesn't have to be impaired in every single area, but there needs to be some significant impairments where, you know, it stops or it makes it difficult for people to interact socially. And we also have ways of, you know, excluding some of that criteria, or some of the criteria that excludes them from the diagnosis. The prevalence of autism. So when I was putting together our workshop for today, I went after the most recent numbers that we've had. So essentially, we have the most recent numbers globally, and then we also have the ones in the UK. So the prevalence globally, according to the World Health Organization, is 1 in every 160 children. It may vary significantly around the globe because of different regions, communities, the different ways of doing the diagnosis, although we tend to take one way of doing this, one way of doing this diagnosis to make sure that it's done correctly and it's accepted throughout the world. However, some countries do still do it differently. It varies as well because of awareness of what autism is, how it impacts development, and access to services. So, you know, obviously, we're very fortunate that the UK, we have a lot of services and a lot of in the NHS really as well as privately. We have a lot of places and professionals who are specialized and able to do this diagnosis and this assessment, but that is not the case for a lot of places in the world.
Where's the lid? Where's the cover? Sorry.
That's okay. In the United Kingdom, we say that according to the National Autistic Society, is 1 in every 100 people, and then people, we do include, you know, adults and children as well. What would be the causes of autism? So when doing this assessment, I have come across a lot of parents, and it's one of the main questions that I get asked, which is what caused this? Where does it come from? And that is a very complex question to answer, because it does involve a lot of interplay of different things, such as, you know, genetic predispositions, environmental exposures, and neurological factors. There's not really a clear answer to why it happens, but it is essential for us to understand that the causes of ASD can be multifactorial. So there's different things that can happen. There could be some genetic component involved. Sometimes, you know, you might have other people with the same diagnosis or other neurodevelopmental difficulties in the family, and that sort of directly impacts other members of the family, or sometimes it just doesn't. It doesn't mean that if you have someone with some form of neurodiverse diagnosis in the family that you will automatically have another person. It does also happen that sometimes you have no history in the family, and yet then there is one person with a diagnosis. So it's quite complex, as I said, and tricky to give like one specific cause. And I think that is what frustrates parents the most, not knowing where does it come from, and as well as professionals, because we do wish we could give you a clear answer to it is because exactly that. But it's important for us to understand, and it's quite crucial to understand that it is very, very multifactorial. There's different things that come into play. But then it's also important for us to understand that this multi-characteristics and causes need to be understood by what each and every person goes through, and, you know, experiences and environments, because that impacts directly interventions and support strategies. And then, you know, if it does come to a point where we say, yes, there's actually a diagnosis here, how we're going to support that person or that child afterwards. So just a brief overview of what the potential causes could be. So we have genetic factors, so genetic predisposition, hereditary links, complex genetic interactions. We have environmental factors, which is, neurological factors, prenatal environment, early childhood experiences, interactions between genetics and environment as well. And then we also have neurological factors, so altered brain development, neurochemical imbalances, sensory processing difficulties. So again, as I said, it's quite a complex and multifactorial kind of diagnosis. The main concepts for autism. So we have social communication challenges, and what does that mean? So first and foremost, what we need to think about is the difficulty in social interaction. So children, and then we're going to think children here, because as we said, it needs to be present from early life, from as soon as they were born. And it doesn't just, it's not something you developed during your life. So we think about children really with ASD might struggle with social reciprocity, finding it quite challenging to engage with other people, back and forth conversations, taking turns, activities. For example, having friends in school, or being able to play with another child, or even, engage with parents and teachers. So there's that difficulty to have the reciprocity, of being able to understand that either someone's talking to you, someone's playing to you, it's not just them. There might be some trouble with nonverbal communication, so difficulty in using and interpreting nonverbal cues like gesture, facial expressions, tone of voice. So for example, when you might get angry or cross at your child and you change your tone of voice, so it might be difficult for them to understand that particular change, or sometimes not being able to tell when someone is happy or sad or frustrated just by looking at facial expressions, or not also being able to use gestures such as, for example, pointing to things that they want, nodding their head yes, shaking their head no, and just being able to express themselves in a way that is non-verbal. And then also difficulty understanding social context. So having trouble understanding what the social norms are, perspective of others, so putting themselves in other people's shoes. That doesn't mean that a child that has that difficulty has no empathy. They can have empathy, yes, but that particular thing about thinking, oh, how would that person feel with my actions or with what I said, there's a slightly difficulty about understanding that perspective, understanding that, other people can feel different than I do. We also have repetitive behaviors and restricted interests. So for example, some children, and again, I say some because it doesn't mean that you have to have all of these difficulties in line for a diagnosis to be done. You need to have some of it. And again, it's not one size fits all. So for example, if we were to say that we have like 20 or 15 characteristics or symptoms that we look for in the criteria to be able to give a diagnosis, it doesn't mean someone needs to have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. They might have 8, and it doesn't mean that it's 1, 2, 3, 4, 5, 6, 7, 8. It could be a 1, 2, 8, 7, 15, 14. Combinations might be different, but we need to see that there are difficulties in all 3 areas of the criteria. So repetitive behaviors and restricted interests. So one of them might be repetitive movements and actions. So engaging in repetitive movement and actions, such as hand flapping, rocking motions, spinning objects, or sometimes spinning around their own, spinning around themselves. Adherence to routines, so a strong preference for routine and sameness, and then disruptions to these routines can cause some form of distress. So for example, having difficulty with change, if something was due to happen, it's not going to happen anymore, and that change is not previously communicated, or the child is not prepared for that type of change that can cause distress, and then fixated interests. So intense focus in specific topics or objects, for example, knowing everything about bus routes or trains or planes, not necessarily just transport modes, but knowing something very specific about Legos or one specific toy, having an excessive knowledge and preoccupation with certain subjects, or specifically playing with parts of toys instead of with a toy as a whole. So those are the main concepts. We also have sensory sensitivities. So when talking about sensory sensitivities, we have different ways that this can present. You could have a heightened sensory sensitivity. So for example, you can be either seeking or avoiding some form of sensory stimulation. So for example, when we talk about our sensors like touch, taste, vision, sound, smell, and then also your vestibular, your, how you pose yourself within the environment. There's also some difficulty with flexibility and adaptation. So being quite rigid in the way that they think, be very resistant to change, difficulty adapting in different situations, and then difficulty with transitions. So when I said, for example, when you change the environment, you have to go from, let's say, one house to another, one school to another, or perhaps if it's hot or cold, if it's noisy or if it's, silent, or even just turn taking, when it's my turn and your turn. So that transition, for as small as it is, might be difficult for them. And then again, communication challenges, sometimes some delayed and unusual speech development, use of echolalia, which is repeating words and phrases that they might have heard previously, or just, as you were saying, repeating straight after. As I said before, and I'm just going to quickly repeat it, there is a variability of symptoms. So it is very important for us to understand that ASD presents very differently in each child or, adults. And the severity and combination of those characteristics can vary very wildly, right? So as I said, some children might have mild symptoms, others might exhibit more pronounced challenges, and is the main reason why we say it's a spectrum. And this is a quote by Dr. Stephen Shore that really does grasp that, which is, when you meet one person with autism, you met one person with autism. So we can't really compare one person to another, one child to another. I've heard sometimes people say, oh, but my child doesn't do this, so therefore he's not autistic, he's not in the spectrum. Yet not really. It might be that he's also in the spectrum, but there's differences between one child and the other because they interpret the world in a different way, and the challenges can come in different ways. So, as I said, it's not one size fits all. Right. So this is what the focus of our workshop is today. So challenging behaviors in autism is something that parents really struggle with, and it can obviously take a toll emotionally on both the child and the parents. Common challenging behaviors that are usually associated with ASD, again, and this might sound a bit tiring for you to hear, but very widely among the individuals. But I think that's the key point that we need to understand, that it does vary, and it will vary. And, everything that I'm saying, again, it will just be different in each child. It is a bit of a same, but different. But the most frequent challenges can include meltdowns or emotional dysregulation. So for example, children with ASD might experience meltdowns and be overwhelmed by sensory input, changes in routine, and might have difficulty expressing their needs and emotions. So for them, things can be quite overwhelming sometimes if it's, let's say, their environment is too noisy, or the lights are too bright, or there are certain smells that really bother them. That can be quite overwhelming, and for them, it's really hard to express that. like, for example, we are probably able to realize this is too loud, I need to leave. This is too bright, I need to go somewhere that is slightly darker. So that causes an emotional dysregulation and therefore a meltdown, because they need to be able to express that they're frustrated, that this is bothering them. And because they don't necessarily have the tools to do that, they might, express themselves in a burst of emotion. So, crying really loudly, screaming, sometimes having, as I said, very repetitive movements to try to self-regulate. There's also some communication difficulties for some of the children, so challenges in expressing needs and desires and being able to really explain how they're feeling or what they need. So, and that usually can lead to frustration, sometimes withdrawal, and, it can also lead to what we call disruptive behaviors to communicate. So screaming or crying, or, just constantly, when a child, for example, is nonverbal, constantly using what we call stereotyped noises, and therefore also leads to potential meltdowns and emotional dysregulation. Some repetitive behaviors can also be present. So, engaging in repetitive movements and activities, some steaming, for example, needing to do certain things over and over again, because that provides them with some form of regular way of, again, emotional regulation. So giving that repetitive way is something they can predict, and it does not overwhelming. So it helps them sort of calm themselves down. And then also some sensory sensitivities. So loud noises, as I said, bright lights, certain textures, certain smells can cause avoidance and distress. Although there's also children who can be sensory seeking. So, some children really like to be hugged really tight, so that touch can calm them down and can provide them with that regulation that they need. Some strategies to manage those challenging behaviors. As parents, I'm sure that it can be quite challenging for you to see your child distressed and not knowing what to do, how to help them. So it is important. And today, obviously, we're just covering very briefly some of the things that can be potentially done and what is available out there. But this is just a flavor for you to understand a little bit about it. So, for example, developing emotional regulation skills. So teaching and practicing your own emotional regulation techniques, such as deep breathing, some mindfulness, some self-soothing strategies to help children manage. So sometimes when parents will come to me and ask, oh, so how do I help my child regulate himself, herself, or themselves? You can either breathe with your child, and it's also very important for you to try to teach them what the emotion is all about. So when they are dysregulated, the first thing to notice is to try to first bring them to a certain calmness. So practice some deep breathing, first of all, going all the way to their level of eye contact, and then trying to see if they breathe with me. You can take your hand, you can put it against your heart or your own chest, and then use the movement to sort of practice that deep breathing. There's different mindfulness techniques that you can apply with children. So, certain sounds that you can put that are calming, and then help children manage that emotion by naming the emotion for them. So it gets less overwhelming, because they will learn that what each emotion is, and also giving them the sense that it is okay to feel that the way they feel, that although they feel dysregulated, there's a name for that emotion and it will pass soon. So for example, some of the parents will say, oh, sometimes my child gets dysregulated and he goes into a meltdown mode and he throws himself on the floor and he's crying and I don't know what to do. So basically just go on their level and then try to calm them down, and then start to name the emotions. For example, you feel frustrated, you feel overwhelmed, you feel sad, you feel angry, and then give them that space to understand and feel that emotion, and then eventually use mindfulness, deep breathing to help them self-soothe as well. There's also some visual and communication aids that can be used. So a lot of people like to use what's called the social stories. So giving a bit more of a concrete understanding for children, which is using pictures or explaining what the situation is or what their routine is with something that they can see, that they can actually grasp. There's also something that we can use as therapists, and then you need to obviously be trained to do that, but it's called applied behavior analysis therapy, that helps, break down complex skills into smaller steps to reinforce positive behaviors and help children regulate their challenging behaviors. That's usually done after you get a diagnosis, and there are certain centers and places like that they are specialized in applied behavior analysis, or we call it ABA sometimes. There's also some sensory integration techniques that can provide, the actual environment in a sensory friendly way. You can use some sensory tools as well. So for children that have, let's just say, sensitivity towards really loud sounds, you can use headphones, or you can use noise canceling headphones or ear defenders. For children who have, quite an anxious presentation and can get overwhelming, there's with blankets that you can, so blankets they're a bit heavier, that will help with that need for pressure, that need to pressure to calm themselves down and regulate, or some fidgety toys, which, they can put them in their hands and then just twist. You have like those fidgety cubes sometimes, even the Rubik's cubes, and it's just a way of moving their hands and help them sort of focus and reduce the distress. For parents, really, and then also for children, social skills training is something that we would do with slightly older children, really, not in the first infancy. So we say the first infancy when it's from 0 to 6. But then after that, when children have a little bit more perspective of the world around them and what might distress them or not distress them, and how they might interpret certain things, engaging in social skills training programs or interventions can be very beneficial, because it will teach them about social cues, what to expect, because it doesn't come naturally for them, but they can learn. So having a diagnosis of ASD doesn't mean that a child cannot learn. Most children, a lot of the children, usually around, let's say, level 1 or level 2 or in the spectrum, are more than capable of learning, even level 3 as well. And you can teach them certain things. So teaching social cues, what to look for, what to expect from other people, something that for us, for example, for a typical person might come naturally. For children with ASD, they doesn't necessarily come naturally, but you can teach what to look for, what to expect from another person. Teach them perspective taking. So for example, what I said earlier, which is paying attention to what it would be like for another person, so you feel this way, but then let's analyze what's going on in the situation and think about what do you think the other person felt. And then appropriate social behaviors in various different contexts, for example, in school and family gatherings, playing on the park, going on birthday parties. So, different social situations that might be difficult. So you train social skills for those areas. Some cognitive behavior strategies. So for example, implementing some CBT techniques, which are specifically to each child to address some anxiety, some repetitive behaviors, helping coping with changes. As your child grows up, he's going to go through lots of changes, and those can also be overwhelming. So ways of you to be able to diminish a little bit of the anxiety that comes with those changes, teaching positive behavior or ways of coping with that stress, with the need for repetitive behaviors, or substituting some of those behaviors with other ones. Some parent training and caregiver training. So obviously, it's overwhelming for children, but it's also overwhelming for parents. To be able to understand all that's available, what's the correct type of skill or resource or support that would be correct for your child. Where do you start? How do you go about it? How do you yourself implement some of these strategies to your own home? How can you as a parent help? So basically, professionals can educate parents and caregivers about, behavior strategies, some positive reinforcement techniques. There are some parents, for example, who get trained in applied behavior analysis and then are able to also use the ABA at home to, carry on with the training and the implementation of the intervention. And then also, thinking about a collaboration and individualized approach. So basically, as I said, it's not one size fits all. Every child will have a different need or a different combination of needs. So it's important that both the parents and the team that's involved in those interventions to be very much in line. And it needs to be, specific and very tailored to each child. And it needs to involve different professionals in different areas. So for example, what we call a multidisciplinary team. So psychologists like myself, occupational therapists, speech therapists, and then educators as well. So school also plays a really big part in it. What I really wanted to focus today was in this aspect, which is the emotional aspect for parents. Now, everything that I said, obviously, is information that's out there. There's a lot of that you can find in different forums, discussing with other parents, sometimes, Googling it, and then some of the things might not be new for you. Some of the things might be new for you. But we spoke about how overwhelming the whole situation, and having this diagnosis and finding this, this interpretation of the world differently, quite overwhelming for children and quite challenging for them. But it's also very challenging for parents because it is not a straight line journey for you to understand that, first of all, you've noticed that your child might have some difficulties. Or maybe you haven't noticed, which is, sometimes it happens. You don't know what to expect. It might be that it's your first child. It might be that it's your second child, but, it's not an right kind of like an in-your-face difficulty that you've definitely noticed. And then sometimes, it's still your child, it's still your baby. And it is difficult for some parents to, sometimes admit that there is some difficulties out there. And because of that, it can be very overwhelming. And then, so when you do notice the difficulties, where do you go from there? Do you get a referral? Do you, talk to your health visitor, talk to a pediatrician? Do you talk to school? Sometimes when parents don't notice, they might have to hear it from school that they have noticed that their child has difficulties, and they think that these difficulties are in line with potential ASD or any other type of difficulties. So it can be very emotional. And then once you do get referred, there's some waiting lists, there's time that you have to wait. There's different assessments, different professionals, all of these very specific terminology. And how is that not overwhelming for parents? So the emotional aspect is very harrowing, can be very hard to deal with, and can be very confusing as well. So I guess the first thing that we need to think about is to be informed about autism. But essentially, when I mean informed, there's two things that I need to mention. The first one is look for information in the right places. At the end of this talk today, I will give you some resources and some places where you can look for some of that information. And then those are trusted sources. But also speak to the correct professionals, talk to other parents, and then focus. The second thing is to focus on your child's need and not the label. Now, I understand that the label sometimes is needed because, especially in the UK, really, if the label is not there, there's a lot of support that is not accessible. But the label per se doesn't do much. What does much is understanding the needs of your child and your child only, and then how that's going to affect their quality of life. So there is a lot of information out there, and it can easily become overwhelmed, as I said. But as we already discussed, every child with autism is different. So main focus here is, what does your child need support with? At what stage in life they are? What is important right now for them? And then thinking more about the now than so much more in the future. Is one step at a time. It is that we cross the bridge when it comes. In the same line, your child has their own unique personality. So again, like just every other child, it's not going to change who he is for you or who she is for you. Regardless of a diagnosis or a non-diagnosis, your child is your child, and you get to love your child just the way he or she is. So sometimes children might have difficulties expressing their own emotions. And for parents, this is really hard, because that exchange, that attachment between a parent and a child is very important. And when you have a child, that's what you expect, right? You expect that exchange of love, that request for cuddles, that playing together, growing together, growing as a parent, growing as a child, and just having that development. But sometimes that's not really what happens. So if your child has a diagnosis and that lack of emotional expression or that lack of overwhelming attachment that you expected is not there, don't think that it's not because your child doesn't love you. Because they might not ask for cuddles, it doesn't mean that they don't love you. You are the center of their universe. You are where they feel the most comfortable with. So when we're doing assessments, or when I'm doing assessments, one of the things that I usually tell parents is, no one knows your child better than you. So at the end of the day, even if there's not that overwhelming expression of love, you are where they feel the most comfortable and the most safe. That being said, there's a lot of feelings that might come with the whole process. And it's important that you don't push those feelings away. And what do I mean about them is that you are entitled to feel overwhelmed yourself. You are entitled to feel angry. You are entitled to feel confused. And it's okay. It's fully okay to feel all of those things. But it's also important that you talk about those feelings and don't sit with them by yourself, just holding it in. Although I said that it's important for us to focus on a day-to-day and what the needs of your child are right now, it is impossible not to ask a parent not to think about the future. They are still years away. I guess this is the normal thought that every parent, regardless of diagnosis or not, if your child is typical or atypical, I think that's always a concern for a parent. What's going to happen in my child's future? What kind of person is he going to be? Will they grow up and have a profession? And then I guess for a parent that has a potential atypical child or child with difficulties, that is even a bigger worry. And there's also that particular worry where, depending of how those difficulties are displayed or how they come about, is he going to be able to take care of himself? Will I need to take care of my child for a very long time in their lives? And if I'm not here, who's going to take care of my child? So that can be quite overwhelming. It is important that you share those feelings and don't take the burden just for yourself. People are not going to judge you. No one is judging you. I'm pretty sure that if you express those feelings, people around you might understand it better than you think. And if people around you might not understand as well, there are professionals and people that can help. And as I said, if you feel angry, be angry. If you feel anxious, be anxious. If you feel overwhelmed, be overwhelmed. I guess for any parent or any patient really that comes into contact with me, what I tend to say is that whatever emotions, in this case, related to a potential diagnosis of autism or a diagnosis confirmed of autism, is that we shouldn't ignore our emotions. If we ignore them, they just grow, they don't go away. they actually grow in size quite fast, and they become quite large, and they can become quite suffocating. So there's a technique that I like to say, which is we should always invite our emotions for tea. So basically what you need to do is try to understand how you are feeling. So if you're anxious, you need to sit with the anxiety and basically just sit and say, so why am I anxious for? Anxiety, what are you here for? Are you here to show me something? Are you here to prepare me for something? Really feel it, and then let it go. And then say, okay, I understand why you're here now. I understand what the consequences of being anxious at this moment is. What's the need for the anxiety to be here now? Okay, I felt it. I understood. Out you go. So you need to be able to understand how you're feeling and be able to take care of that, because if we're not well, we're not able to care for anybody else. It's the oxygen mask on a plane. Usually that we use that particular metaphor to explain this to parents, is that whenever you go on a plane and the stewards will say, you know, if there is a chance that we lose pressure in the plane, oxygen mask will fall, and then usually they'll say, put your oxygen mask first, and then you put it on a child or someone that needs your help afterwards. The reason for that is that if you don't put your oxygen mask first, you're not going to be able to breathe. And if you're not able to breathe, you're not able to help anybody else. It's also important to remember that you are a separate person from your child. And it can be, as I said, very all-consuming, the process, the road, the journey to understanding that there's a difficulty present, understanding what the steps are to get a assessment, a potential diagnosis, what to do with the diagnosis, the support that's available, what's the future going to look like. And it can be that it gets all consuming, and this is all that consumes your every waking hour. It is important to make time for yourself if you can, to spend some quiet time with other loved ones, to share the burden with whomever you can, if that's family, if that is your own village that you've built, if it's, you know, blood-related family or friends' family, or, you know, colleagues or people that are willing to help. There's always people willing to help, and it's important that you do share the burden. You do not have to be alone in this. It's also important that you appreciate your child's victories, no matter how small. So sometimes a really, really small step, a micro step, is something to be celebrated. Don't think big, think small, think one day at a time, and do not make comparisons, you know. First of all, we usually say we shouldn't compare children, you know, although I know some parents do compare their children, but you shouldn't compare your child with anybody else's child, or even if you have more than one child. Everybody's development is different, yes. But obviously, you know, some of the things that are expected, some of the milestones and some of the things that should be there might be there. And you can't just say, oh, you know, but that child does this, my child doesn't, or my child does this, the other child doesn't. Like I said, it's not a one size fits all. But if you do manage, let's just say after a diagnosis, there is a post-diagnostic support and the support available, and you see that there is a small gain from that, you know, just really celebrate it, because it's really important to think about, yeah, you know, it's very small, but we can, with this one small step, another small step, another small step, and look at how much you gained. As I said before, you know, you're not alone. It's important for you to develop your own little network in your own village inside of the ASD world as well. Exchanging experiences with other parents that go through the same or something similar that what you're going through, if it's at the assessment stage, if it's the post-assessment stage, or, you know, even the after the support has been put in place. It's also good to exchange those experiences, because sometimes a parent of another child will come to you and say, oh, you know, this is how my child behaves, this is how ASD presents on my child, and then you might be able to say, this is how my child behaves, and this is how it presents on my child, and then you can see some similarities there. And you can exchange that, oh, this is what I've done, and this is what worked. This is a service that I found, and then it has helped me. This is a book that I've read, and it has helped me as well. So the exchange, sort of building a community of supportive and understanding people, and taking advantage of all the services and activities that are available for autistic children. There's a lot of things that are available out there. Sometimes they're not easy to find, but if you ask around or ask on your own developed network, doing some research, asking professionals, there's a lot for you to do. There's a lot that can be done in-house, in your own house, in your own home, and there's a lot that you don't have to wait for services to give you. The last two things are consider integrating your child. So, for example, you don't immediately have to think about special services specifically for your child just because he has a diagnosis or she has a diagnosis. You can try to integrate them in what's called the mainstream services and activities. A lot of children with the ASD diagnosis are able to still study in a mainstream school or in another mainstream activity. Those places are a lot of the times trained or aware of what we call reasonable adjustments that can be done so your child can have, you know, the best of the best and doesn't necessarily need to be separated or segregated from you know, having that contact with other children. It's not about making your child fit in. It's just basically, you know, adjusting what we call the reasonable adjustment of activities to accommodate for certain difficulties that, because at the end of the day, we all have difficulties, but these might be a bit more specific. So integrating them into social situations, it's a way of, you know, social training as well. And then getting involved, really. If you can, after all of this, try to get involved. As I said, try to build your own village. Try to put your energy towards bringing more people together and bringing the change that you really want to see. Sometimes I get a lot of parents that are frustrated because they're either a lack of support, lack of services, lack of people with attitude that are willing to help. And there's that lack of sort of proactiveness. So really, if you can, and if you have, let's just say, you know, the will to do it, try to be as involved as you can. Try to put together, you know, groups of parents and let's do this together. Let's try to see what we can change and what we can actually demand as well in terms of support. Thinking about a lot of those emotions for parents before, there's also the way of us understanding emotion for children. There's some challenges which children with autism may face with understanding and expressing emotions. So I've mentioned it before that the overwhelming way of not understanding those emotions can cause meltdowns, can cause, you know, a lot of distress. But what is it? What is that distress? What is that overwhelming feeling? Sometimes for them, understanding what the emotion is, and I think I've mentioned it as well, you know, why we need to name the emotions and explain and show them what the emotions are. The lack of understanding is what's difficult. And if you don't understand something, how can you express it? So for children with ASD, for other children as well, but we're focusing on the children with ASD here, there's a difficulty in identifying those emotions, hence why it's important for us to be able to name, explain, and show them what the emotions are. So for example, difficulty recognizing, labeling, giving a name to that emotion, to their own emotion, to other people's emotions, or emotional cues. So facial expressions. So mom is not using, let's say, a loud voice, or mom is not crying, but it's hard to understand how mom's feeling just by looking at her face, because I just don't understand. I have no idea what that emotion is. So that's why it's important to help them identify those emotions. Give them the emotions a name, because sometimes they might have a limited emotional vocabulary. So for example, yeah, okay, I get how I'm feeling, but I don't know the name of what I'm feeling. So it's important for you to name and describe how they, okay, so you're feeling frustrated. When you feel frustrated, you might get, tense with your body. You might want to sigh. You might want to just go like, just leave everything behind and not do. It can be described in a simpler way or in a bit more complex way, depending on your child's age, but it's important to give them that vocabulary to express themselves, because otherwise, how will they be able to say it? Some of the emotions can come as well from sensory overload. So that can impact emotional regulation. So when sensory sensitivities come into place, they might overwhelm children. So say, for example, they are in a very noisy place. Let's just say a mall or a restaurant where people can tend to shout or talk really loudly, or there's a lot coming, like sometimes in the mall you have not just people talking, but you have sounds of, someone selling something, or machines making noises. There's a lot going on. That can also affect emotional regulation and their understanding of emotions. So if they don't have a way of identifying how that makes them feel and a way of expressing what it is they're feeling, if you put the sensory overload into it, that's a bit of a recipe for dysregulation. Children with ASD as well, their emotions can affect their perspective taking. So it's a struggle to understand other people's perspectives and emotions, how that, leads to again, it's not that they don't have empathy, but it might give them a challenge into understanding that, other people also feel dysregulated, also feel frustrated, also feel sad, also feel angry. And then that will also impact on the quality of their social interactions, because if I don't understand how I'm feeling, how am I going to understand how another person is feeling? And then how am I going to understand what this situation is? How am I going to express myself? Or how am I going to offer something to contribute in this particular exchange if I don't understand what's going on here? So the difficulty in perspective, it's kind of like a domino effect. Identifying emotions, giving an emotional vocabulary, helping with the environment, helps them also understand and get a little bit more perspective taking. Now, there are some strategies we can use to help children identify emotions and manage and recognize those emotions. The first one being using visual supports, like, for example, emotional cards. So cards with each emotion described, and or a facial expression, and then teaching them which one. So this is happiness, this is anger, this is frustration, and then helping them use. If they cannot express and say, I feel angry, I feel sad, I feel frustrated, you can show them the cards and say, how do you feel compared to those faces, compared to those emojis, compared to, what's here? Do you feel happy? Is that the one that you feel at the moment? You can use social stories. So the social stories really, they describe a social situation or something that might happen. I'll give you an example for some of my patients in the hospital. They don't cope very well with change. So if something is going to happen, they will need an explanation. So what we do is we explain. For example, I'll give you a very real example of what's going on at the moment. There's a bed bug situation in the hospital that I work for, and a lot of fumigation and things are in place at the moment, policies in order to eradicate that. However, fumigating the wards, for example, involves, stripping their beds, throwing away the bedding, having all of their things packed and put into bags, and usually thinking about the sensory input of how those things affect their environment, and then how can this regulate them. We had to basically use a social story explaining the ward is going to be fumigated because we have bed bugs in the hospital. The reason why we need to, so you basically explain what's happening, when it's happening, where it's happening, in a way that it's explained like by using pictures and the reasoning why. So that's what's a social story. And it helps them understand what's going on, understand how they feel emotionally towards it, and then give them an appropriate time to process and have the appropriate or a better understanding of their emotional responses. Because if you can imagine, for example, if that's all going to happen, we don't tell them that it's happening, and how dysregulated will that person be? Because you're basically just taking away everything that makes them feel safe, everything that helps them manage those emotions. So for example, if it's, let's just say someone is attached to their pillows and to their duvets, and you have to take it away without explaining. So social stories is a way of explaining things that are going to happen. So you're going to a birthday party, and the birthday party is very noisy. You can use that to explain such and such person is having a birthday party. In a birthday party, what's expected is there will be other children there. Children might be screaming, children might be making noise. We'll be singing happy birthday. So you use that to create a social story. We could do some emotional recognition activities. So for example, again, some activities that might focus on recognizing what emotions are in place in that particular situation. For example, for children who are slightly older, you had a problem at school, and this problem affected you directly. How did that make you feel? And then you pose the emotions that would be the normal in that particular situation, and then you help them understand. So this is how you felt. Let's just think about the other perspective. Say it's a problem between two children. If you were in their situation, so how would they feel? What would they do? And how would you respond them? So you use that role playing, or what we call as well mirror exercises. You can use some videos or some cartoons, and then discuss, what do you think that particular character was feeling, to modulate and that recognition, really. And then you can teach coping strategies. So as previously I've mentioned, some deep breathing techniques, some mindfulness, some way of taking the person away from the sensory overload. You can model and label emotions. So for example, in everyday situations, describing your own emotions in this, let's just say there was an overwhelming situation for your child. You can start by saying, yes, I understand that particular situation was overwhelming for you. This is how I felt. It made me feel nervous. It made me feel frustrated. How did it make you feel? So you give them an example of how the emotion was for you, what feelings came about, and how would you deal with those feelings? And that helps them create a model. Oh, okay, so if my mom feels like that and my dad feels like that, then this is how I feel. If they dealt with it like that, this is how I would deal as well. Create predictable routines. So for some people, the predictability can be quite good, really, because it gives them a way of reducing anxiety, and then it helps them also regulate their emotions because they know what to expect. Obviously, that's not possible every time, but if you can sort of create a routine or what to expect, you can, going back to using the social story, explaining everything that's going to happen, previously giving them time to process what will happen, giving that predictability, will greatly help reduce anxiety and emotional dysregulation. You can encourage self-expression. So, sometimes children might not be able to, even if you do all of that, there might still be difficulty nominating the emotions and expressing themselves just by saying what they feel. So there's other alternative means you could use, for example, drawing, writing, using their own visual aids, by music, by their own creations, like with manual activities, you know, such as some children like to crochet, some children like to do with Play-Doh and then just do things. Some children like to use Lego. So different ways of helping them express how they're feeling by using objects, really. Again, this is a bit of a repetition, but social skills training, you know, participating in social skills program, focusing on emotions, perspective taking. This is for older children, really. Understanding social cues. So what is a social interaction? How do you positively use empathy? Some positive reinforcement and encouragement. So trying to understand really a behavior from your child. Usually when we're trying to understand behavior, we look into what we call what comes before the behavior, the triggers, the actual behavior, and what the consequence was. So once we understand the behavior, where does it come from, we can either, you know, we can, if it's a good type of behavior, it's a good thing that we want our children to do, like expressing their emotions, we can reinforce and said, it was really good that you said how you were feeling. It made me understand better that you were frustrated. It made me understand what frustrated you. So you clearly communicate that that expression was actually acceptable. And then, you know, hopefully reinforce them to keep on doing it. Seeking professional support. So working with therapists, with psychologists like myself who specialize in autism. Usually whatever professional you're going to look for, my tip is to make sure that they understand what autism is. There's a lot of professionals out there. There's a lot of people who can provide you with good support, but ideally in this case, someone who's got a specialty, a good knowledge about what the diagnosis is, or what the potential diagnosis is, even the pre-assessment. Someone who has that knowledge might be able to support you better and help you as well tailor, you know, and make it a bit more individualized strategies on how to deal with the pre-assessment, the during assessment, the post-assessment, whatever the outcome of the assessment is. And then we'll help you as well as tailor all of these that I've mentioned before, and make sure that it's tailored specific to your child, to your family, to you as well as a parent. So now I'm going to speak really, and this will be a brief storytelling really about a previous patient of mine. As I've mentioned in the beginning, I've got her consent to speak about her own journey. So Louise is a 42-year-old woman. She's got 4 children. She's got Lila, Adam, Julie, and Mason. Louise is not her real name, by the way. And the children is also, you know, different names I've used. So Louise has faced many, many challenges trying to understand and find an answer to the difficulties she was having while her son Adam was in his early development years. So initially, she only had Lila when Adam was obviously diagnosed. And Lila was a typical child. Her development went, you know, reached all of her milestones. There were no difficulties in school. She's quite sociable as well. So when Adam came about, he was a bit more of a quiet child. And she didn't find any difficulty with him. For her, it was just, you know, he's a boy, she's a girl. There are differences there, but she didn't really notice anything specific, or didn't know the difficulties really didn't like shine for her. And it was actually the school that called her for a meeting one day and said, we've noticed that Adam has difficulty interacting with other children. He doesn't really know how to deal with his emotions. There's a lot of meltdowns. We're not sure how to best support him. There's a slight speech delay as well. We've noticed that there's a lot of repetition to the things that he says, some form of echolalia. And we thought it would be really good to perhaps refer Adam for a specialist assessment. At that time, Louise came into a clinic, and She was seen by different professionals as well as myself, and we had different stages to this particular process. She was on the waiting list for a very long time. Eventually, she decided to go privately because she just wanted an answer. At some point, it got so overwhelming for her, understanding that there was difficulties in her child, that after they were pointed out to her, she started perceiving it a little bit more. And she started getting very anxious because she didn't really know how to support Adam, and also how to support Lila because she had 2 children. She also, I forgot to mention, Louise is a solo mom, was a solo mom at the time. And so she was very overwhelmed with the whole pathway and understanding. Eventually, when she did manage to go to, she decided to go privately. She decided to get, other professionals involved. There was the process of the assessment. She was seen by myself and a colleague of mine, which we discussed, and she was able to express all of her anxieties, all her worries and difficulties. We saw Adam. We did his, eventually, he got a diagnosis. We did all of his assessments. But then we did the afterwards support for her, so the post-diagnostic support, where she was very scared, overwhelmed, and not sure how to best support her child. She was very mindful of having the label of autism for Adam, how she felt about that, how she felt that this would singled her child out from other children, that she wasn't really concerned, or she really didn't want that label for him. We did a very good a few sessions and a very good talking therapies really with Louise, where we've explained to her that essentially it wasn't really about the label, it was more about the quality of life for Adam. So eventually Louise understood that sometimes when we're giving a diagnosis, we might use the word that your child benefits from a diagnosis of ASD. The reason why we say benefit is because we want to make sure that your child can thrive as best as possible, and we want to make sure that we increase your child's quality of life. Although that was essentially the outcome that we came to at the end, and benefit was the right word for Adam. He benefited from a diagnosis because eventually with that, he was able to access the right type of support. Louise expressed to me at the time that the feeling she got from the diagnosis was really grief. And when I asked her about grief, she said that what it felt for her was that someone had taken away the child that she had and given her a brand new child to deal with. And she was very confused and grief-stricken because at that time, when she only had Lila and Adam, she had thoughts and dreams that every parent has when they have a child. So what kind of man would Adam be? What kind of future would he have? And for her, when we gave her the diagnosis, although it did give her a lot of answers and some form of comfort, she did feel like all of those dreams and plans that parents do have, and she certainly did have for him, were taken away. So for her, she was very ambiguous towards how she felt afterwards. She felt very relieved. As I said, there was some form of comfort because she finally had an answer and she had ways and means on how to help her child, but she also felt grief-stricken. So we worked together for a very long time, where in our work, we worked with both sides. So we did not dismiss the feeling of grief. We understood that. Louise understood that it was important for her to really grieve for those plans and thoughts, because if she didn't do that, she didn't do that, she wouldn't be able to actually support Adam the best way possible for him to have the best quality of life in the future. So after that understanding, that emotional work, that passed through the grief, she was able to actually understand that you know, this is just a label. And with this label, I'll be able to support my child and I'll be able to increase his quality of life. And now Adam is at this, he's 8 years old and he is learned a lot. He was able to overcome some of his difficulties in the sense that he still has them, but it's a lot easier now for him to deal with it. Louise knows a lot more how to support her child, and she has a whole village around her. So from her perspective, there was a double-edged sword, really. There was relief, but there was also grief. And with this story, really, the reason why I wanted to give her perspective was that for parents to understand that it is okay to have both sides, to want what's best for your child, to want that support and to look for it, but also to feel a bit disheartened by it. And it will pass. Eventually, you will turn that corner and you will be able to understand that this is actually good because it will help your child to live their best life. Now, when we talk about childhood autism, we talk about the importance of early intervention and seeking professional help. Now, I do also see adults, and there are some adults who have gone through their entire lives without having the correct diagnosis, and they eventually get diagnosed when they are adults. That, unfortunately, keeps them suffering for a very long time in their lives where they don't necessarily fit in, they don't necessarily understand the world around them. It might be difficult for them to establish relationships. It might be difficult for them to be able to fit themselves into, let's say, professional world, personal world, with their friendships, with really how to live around in society. So whenever there's difficulties noticed by either school or parents, although that can be quite scary and you might not want to see and think, oh yeah, there's some difficulties there, maybe I should go for an assessment, maybe I should look more into it. The earlier the diagnosis, the earlier the answer, and the earlier the intervention, the best chances you will give for your child. So early intervention benefits, really. Early intervention can significantly improve outcomes by providing, you know, specialist support, the right reasonable adjustments for your child, very tailored to their needs, really. Can enhance communication skills, social skills, social interactions, can adapt behavior. The best way to have, you know, as again, I feel like I'm being repetitive, but it's important to repeat this, to provide them with their best quality of life in the long term, really. Early intervention can give you effective strategies for support. So being able to implement and identify what's evidence-based interventions, some form of behavior therapies, behavior analysis, understanding what those behaviors come from, adapt towards education programs, and mitigate some of the impact that the ASD symptoms might have on your child. It is good to, from the beginning, from the get-go, to develop some coping mechanisms. So again, helping those coping mechanisms in social skills, giving strategies on how to manage the challenges that might come with supporting your child, but also for your child to pass those hurdles. The early intervention can also help you, you know, accessing the correct professional help, understanding the diagnosis, how it affects that, you know, it's a spectrum and whereabouts perhaps your child is in the spectrum. And then again, being able to point you towards the correct type of professional to help you out. Again, early intervention might help as well with family support and guidance, guiding the people around you, guiding your family, guiding yourself on how to best support your child in education and you know, empowering whoever is around your child, that again, being you, being other caregivers like grandparents, aunts and uncles, siblings, on how to best support your child development. Now, just briefly, how a diagnosis in childhood autism works. So, as I said, there's initial concerns and a referral. The initial concerns can come from yourself, can come from a healthcare professional, or sometimes from the school. Then referral is made. Once the referral is accepted, there will be a screening and a preliminary assessment for us to understand that what we're seeing and the difficulties we're seeing might be related to a potential diagnosis of ASD or neurodiversity. If it's a thing that's more specific, then another referral might be made to a very specialized service. If it's specifically around ASD, so a service that specializes in autism and it does know exactly what they're dealing with and how they will assess this child, then a comprehensive evaluation will be done with a multidisciplinary team, a detailed assessment. So, you'll be seen by a psychologist, a speech and language therapist. Sometimes an occupational therapist will be involved as well as a pediatrician. So we'll make sure that we assess in all areas to be a very robust assessment to be able to give you the most complete answer possible. And then a diagnosis or a non-diagnosis, it really just depends on what the outcome is. In this detailed assessment, there's a parent and caregiver interview. So for example, we will ask you questions from your child's development from conception, really, for us to understand how did that happen, how was the early years, depending of, let's just say your child is slightly older, 8, 9, 10 years old, or sometimes they're young. We will want to know about milestones. We will want to know about, every single thing that made your child. So the experiences, as I said, a child is born with autism, but we need to understand, if there's any genetic components. So that's why parent and caregivers are, interviewed in a very detailed, oriented interview. We will observe your child. We'll do behavioral assessments. So it is a very robust thing, really. And then after that, there is a team discussion, really, because we need to see from different perspectives that we are all seeing the same thing. And then we'll give you a feedback. So we'll give you an answer. Yes, it's autism. No, it's not autism. What do you do from here? Who do we disclose the diagnosis to? And what support is available? So we'll give you some form of post-diagnostic support. So guidance for parents, really, again, how to best support. We did talk a little bit about this, but sorry, let me go back here. Just to review, really, what the guidance really for parents are for supporting your child before we finish for today. Understanding and acceptance. So educate yourself about autism, how to better understand your child's strengths, challenges, and needs. Try to embrace their uniqueness, because when you do that, it might make it easier for you to be able to support your child, to understand how to best support your child. In the same sense, creating a supportive environment. So for example, establishing a structure, a predictable routine, creating your own village, having other people around you who can provide that sense of security, help reduce anxiety for your child and for yourself. Implement communication strategies, so use visual supports, social stories, clear and concise language to aid in understanding, communicate emotions, name emotions, explain emotions, encourage social interactions. So, it might be that children might not be comfortable interacting with peers or siblings, but if you create a structured way for them to do so, it will help them develop social skills. Develop your own coping mechanisms, and your child's coping mechanisms. So teach and practice coping strategies. So for example, as I've mentioned previously before, some mindfulness, some breathing exercises, some teaching of emotions and what those emotions mean, giving them a vocabulary to identify those, giving them an environment that is tailored to their sensory challenges. Yeah. And some positive reinforcement. So for example, when certain things that you've implemented happens, desired behaviors are happening, accomplishments are done. You can say, yes, you know, it's very good that you've done this. I understand what you're saying. That was really good that you were able to express how you were feeling. I understood what you're saying. Can you explain it a little bit more? Let's explore this together because this was really good. Being sure that you are accessing the right types of services and interventions. So always seek professional help of people who are experienced in autism, people who either have a specialty in it or, you know, have worked for a very long time, and being sure that the interventions are tailored to your child. As I said before, it's not one size fits all. If you met one person with autism, one child with autism, you met one child with autism. So what your child goes through, another child might not go for the same. So it's important that it's very much tailored. And there is a range of professionals involved. So psychologists, speech therapy, occupational therapy, some form of therapy specific to ASD, like applied behavior analysis, perhaps. And then advocate for support, really. Advocate for your child's needs. Do not be afraid to request, to make sure that you ask school settings, you know, educational settings, what's being done for reasonable adjustments to be done for your child. If needed, you know, individualized education programs, like in the UK, some children might have EHCP. Appropriate accommodations in school, as I said, reasonable adjustments. There's a whole list of things that can be done, that can be discussed with the school or with whatever service your child has interactions with. So this is just some things that can be done, some things that can be put into place to deal with the emotional side and how overwhelming that can be for both yourself and for your child in the journey of finding a diagnosis, of finding an assessment, the whole process, really. I've added here some additional resources. Obviously, there's a website of the clinic here, which has a lot of information on how to proceed with the assessment, with the screener, and then an initial referral, really. But there's also other information that's quite useful there. And then I've added 3 blogs. You can find them on social media as well, of parents with children with autism. The first one is Stories About Autism, and it's James, Tommy, and Jude are his children. So Jude is the oldest, Tommy is the youngest. Both Jude and Tommy have autism and different levels. James is based in the UK, so he's a bit more versatile with what happens in the UK around autism stories, services, and he's quite responsive as well. He communicates very well with people that follow him. So he's on Instagram, he's on TikTok, and he has his blog where he writes a lot about the journey. So it's quite good for you to read and try to see if there's anything that either be similar or resources that you might find, or sometimes even just see that there are other parents out there who might feel the same way that you feel, or who have been in this journey for a very long time and might have more resources or ways of coping with it. We have the Autism Cafe. Her name is Eileen Lamb. She's autistic herself. She has 2 children, so she has 3 children really, but 2 of them have a diagnosis of autism in very different levels of the spectrum. She got a really late diagnosis herself. She has Jude and Charlie. Charlie's the oldest, Jude is the youngest. Jude is a bit more functional than Charlie. Charlie's nonverbal, Jude is verbal. And she also explains a lot about different aspects of having a child with ASD and having ASD herself. So it's very good. She's also on TikTok, on Instagram, if you want to give her a follow, or there's also her blog here if you want to have a read. There's also Kate from Finding Cooper's Voice. she's got 4 children. Cooper is the oldest and the only one with a diagnosis of ASD. Cooper is nonverbal, but she also has a lot of hurdles that she has been going through. He's already pre-adolescent. He was diagnosed when he was 2.5 years old. But there's tons of really good information. Although both Eileen and Kate live in the US, a lot of the same thoughts and feelings and the emotional hurdle that you might face as a parent can be the same. So you got James, which is from Stories About Autism, who lives in the UK, who might have a lot of information and good strategies that are a bit more applicable here. You can also read about Aileen and Kate's story on both of those websites. And there's also the National Autistic Society, who also has, you know, a whole website full of resources and material that you can do your research. That's it for me, and we can do some questions now. So if you want, you can put some of the questions on the chat if you have any.
Thank you, Julia. That was brilliant. I guess we'll give it a couple of minutes if there's any questions, and there's nothing in the chat at the moment. But we will be sharing the lovely talk on our YouTube channel shortly. I'm
going to leave the websites just now. I won't stop sharing the screen, just so if you want to, you know, copy the links and then take a look at it at your own time afterwards, you can.
Great. I think we'll round up there. We can share the links on our Instagram page as well, and we can obviously put the talk up on our YouTube channel so that all the information will be available. Thank you very much. And we're running a couple of other talks, one next week at the same time on Thursday, and then one the week after. And then one next week is on sensory sensitivities for children, and the week after we are running one on where you can just have a question and answer session with one of our highly specialist speech and language therapists. So we look forward to seeing you then, and thank you very much and have a nice evening.
Thank you.
Thanks.
Thank
Bye.
you.